March and ends on the 7th of March 2025. We will now call into the podium Mr. Wakio Jr., Director for Reform Civil Service Agency, Liberia, who's going to do our welcome remark for us. You're welcome.
Hello everyone in TV land. This is Focus on Liberia live broadcast at the Ministerial Complex, that's the Ellen Johnson Ministerial Complex, where a 4-day public service leadership conference on health workforce development held under the auspices of the Civil Service Agency. My name is Gwendolyn Dorado. You're welcome to the live broadcast.
Dr. Josiah F. Joga Jr., Deputy Director General of the CSA, Honorable Banjay Smith and Mugabe, respectively, members of the diplomatic presence, our development partners, esteemed members of the panel of experts representing Côte d'Ivoire, Burkina Faso, Sierra Leone, and the Republic of Liberia, senior management and staff of the Civil Service Agency of Liberia, members of the press, listening audience, distinguished ladies and gentlemen. Once again, a very good morning. I would like us welcoming our distinguished delegates to Liberia. I can imagine most, if not all of you, have the change price before arriving here. But seeing you here in good spirits tells me this was all on profit. This is the inaugural edition of what will become a continental phenomenon, a platform for knowledge sharing towards the advancement of human health workforce. This conference, the Regional Public Service Leadership Conference on Human Health Workforce Development, is being convened on the theme Advancing Human Health Workforce through Public Service Leadership, building resilient and innovative institutions for sustainable development. On behalf of the CSA, as the Civil Service Agency of Liberia, it is my singular honor to welcome our technicians from Sierra Leone, from Burkina Faso, from Côte d'Ivoire, and of course, host country Liberia, to this meeting gathering of sector technicians and policymakers who have come together to pioneer this groundbreaking initiative. It is both an honor and a privilege to stand before you today as the chairman of the Planning and Execution Committee for this crucial regional conference on human health workforce development. I was nominated by the Director General of the CSA, Dr. Joga, as a focal person for the implementation of this important partnership between the CSA, the Ministry of Health, and the Health Development Partnership for Africa and the Caribbean, EPA, based in Rwanda, Kigali, Rwanda. A role that requires close collaboration and coordination with all of you who are present in this one. This conference marks a significant milestone in our efforts to address the challenges and opportunities within our human health workforce. And I'm proud to see it come to fruition with the collective support of my colleagues and partners across the world ministries and agencies. As the chairman of the Planning and Execution Committee, I have the responsibility of overseeing the logistics and coordination of every aspect of this event, from liaising with key stakeholders, ensuring that all necessary preparations are in place. It is a skilled daily team effort, and I would like to take this morning to recognize the valuable contributions the members of the Ministerial Steering Committee, comprising the Ministry of Health, the Liberia Airport Authority, the Liberia Immigration Service, the Ministry of Foreign Affairs, the Liberia National Police, the Ministry of State, and last but not least, the service agency. We will try to made this conference possible. From the careful arrangements of invitations, security entry visas, ensuring protective security measures, and facilitating all the logistical setups, this committee has worked around the clock to ensure everything is in place for a successful event. Human health workforce development is critical, both for health sector and civil service at large. A strong, well-trained, and adequate supported health workforce is essential to delivery of healthcare services and improving health outcomes. Therefore, I want to use this. Okay, so I'm sorry. So, there's a very around the application going on, so please forgive me. I was still on this. It is both an honor and privilege to stand before you today to welcome you to this auspicious conference, which has been in its early stages for more than 2 months. As we start this conference with the convening of the panel of experts, I want to entreat you to follow through on discussions, which will ultimately end in the production of a framework and, of course, a resolution that will be validated and adopted by all member countries here present. Thank you, and have a wonderful day.
Thanks to Mr. Yoko for our welcome remark. We will now take self-introductions from our panelists of experts.
I think I will interrupt a little bit. Instead of us doing the self-introduction, we are calling them for their remarks, because each country will make a remark and will be represented by one of the panel of experts.
Okay, next we will now have our general overview of a panel of experts working sessions by Dr. Josiah F. Joha Jr., Director General Civil Service Agency.
Thank you, my good friends. Like I said, I know moments from now we'll start singing songs about Sierra Leone and Burkina Faso, about Cote d'Ivoire. It is a distinguished honor for me to recognize you, Minister of Health, Dr. Louise Margaret-Oso, who is a guardian for many of us, and a mentor, and somebody who has brought innovation and creativity to our health sector, helping with health sector reforms in our country. Minister, we want to welcome you to this conference. We'd like to recognize Mr. Sebastian, who represents HEDCAC. We want to welcome you, sir. We want to recognize the representatives of the delegation you see on the platform. We have the Republic of Sierra Leone, we have the Republic of Burkina Faso, and we also have the Republic of Cote d'Ivoire. We were supposed to have delegations from the republics of Guinea and then the Central African Republic. We know that Wednesday will be the arrival of the heads of delegations. The people here today are just experts. So it is still our hope that those people will join us for the event from the 6th to the 7th. But for today, the 4th to the 5th is actually for technicians. It's a pure technical working group. Health and public service experts have gathered to work together. So this conference, the regional Public Service Leadership Conference on Human Health Workforce Development, is convening here in Monrovia, our beautiful city, the capital of the Republic of Liberia, specifically here at the Ellen Johnson Sturdy Ministerial Complex. The theme of the conference, as already stated by the chair of the Service Committee, is advancing human health workforce through public service excellence, building resilient and innovative institutions for sustainable development. I have spoken about the participating countries. So far now we have 4. That's Liberia, Burkina Faso, Cote d'Ivoire, and the Republic of Sierra Leone. And we are hoping that the Central African Republic and Guinea, the Republic of Guinea, will join us at some point. So the conference is being supported by the Health Development Partnership for Africa and the Caribbean, HEDBAC. They are providing support to this initiative. As a matter of fact, HEDBAC, the Ministry of Health, and the Civil Service Agency will formally sign an agreement where CSA and the Ministry of Health will work together with a special focus on employees of the health sector. There are several issues that are common to our countries here today, and one of those issues we will be working as 2 entities in this country to work towards improving the well-being and performance of health sector workers. So that will be a part of the proceedings of the conference. So why the conference? Why are we having this regional public service conference on human health workforce development? There are 4 cardinal reasons laid out in the concept table that establish the basis for the holding of the regional conference. Factor number 1, we have interconnected challenges the countries involved, West and Central Africa in particular. Our public institutions face common governance issues, including limited financial and human resources. This is common across our countries. We have outdated infrastructure, and we have inefficiencies in governance systems. This is something we cannot shy away from the countries that have come together today. So interconnected challenges is one of the reasons for which we're having this conference. Factor number 2, we need a platform for collaboration. We need to work together. So this conference will serve as a catalyst for cooperation, for knowledge sharing, and strategic capacity building. We have talked about the interconnected challenges, ranging from limited resources to inefficiencies. How can we deal with that issue, with those issues? We will have to work together to be able to share knowledge and to collaborate on strategic capacity building and institutional reform. So that's factor number 2. Factor number 3, we have to strengthen public sector performance in our respective nations. Very important for improving governance and the service delivery. So the conference aim is to enhance institutional effectiveness, transparency, and accountability, thereby equipping public service organizations like ours to meet the demands of a rapidly evolving global landscape. So this will have to be part of our collective responsibility. And it's only a gathering like this, a conference like this, that can help us to forge collaboration and partnership to succeed in achieving those critical milestones. The final factor that brought us together is innovative solutions and best practices. So, for the next 4 days, policymakers here, including public administrators, health experts, and development partners, together will identify and develop actionable frameworks for governance reform. So So in essence, we have gathered here today historically, and I'm saying historically because the Ministry of Health has been in this business for a very long time because some of us speak to public service. But I don't remember any point in time in our history where probably across our region or Africa, where we have come together to establish a regional platform with specific focus on human health development workforce and to share ideas, to pool resources, and to help each other bridge gaps where we identify gaps or weaknesses. I'm not sure we've had this. So together I believe we are making history today. And like my colleague, the chairman of the steering committee indicated, this will be the beginning of us coming together to have such continental platform. Because after this conference, it is my hope and our collective hope that other nations will join me to expand the platform so that we can begin to take these critical actions. There are 4 key reasons why we are here. 1, we have common challenges. 2, we have to establish a platform for collaboration. 3, we have to strengthen our public sector performance. And 4, we have to be innovative and creative in establishing solutions and best practices. That's why we are here. So this conference is in 2 phases. Phase 1 begins today, which will be officially opened and addressed by the Honorable Minister of Health of the Republic of Liberia. It is only designed for experts, even the people who are on the platform. They are not the heads of delegation, they are only filling in. That's why you see their faces there. They are representing their countries, but they are all experts. The heads of delegations are arriving on Wednesday. These experts will work today in breakout sessions. We will not going to be in this room for long. This hall is only for plenary discussion. The breakout sessions are the 2 rooms already set up at the back with everything that is needed for the group discussions. So we will work today on thematic areas, and then tomorrow they will work to finalize the draft regional framework. That is the objective for the next 2 days. The next 2 days will be intense work. The experts will work, they will align, they will share ideas, they will bring their country perspectives to the table, and they all will align to develop a regional framework that reflects the reality of our healthcare workers, of public service workers contributing to healthcare delivery systems in our nations. So that's part 1. It's going to be compulsory collaboration, that's the framework, and it's going to strengthen governance, and it's going to ensure efficient public service delivery. The framework that will be drafted for Minister Poto and her colleagues who will be coming on Wednesday to review, validate, and adapt will ensure that it fosters collaboration, it strengthens governance, and it ensures efficient public service delivery. So phase 2, from I6 to 7, the heads of public service institutions and ministers of health or their representatives will join the panel of experts who are here already to review, validate, and adapt the regional framework document, which might be called any special name to agree. An example would be the Monrovia Declaration. I'm pleased to inform you that so far, we still have the commitment of the executive mansion that His Excellency, the President of the Republic of Liberia, Joseph Yuma Boakai Sr., will deliver the keynote address on March 6, 2025. That is to officially address this conference. We are hoping, because you know that the President is scheduled in change at the time, but we are really hoping that we can have the blessing of His Excellency to come and grace the occasion. So the panel of experts will come together when we are done with the opening session. We do a small presentation to set the stage for the breakout sessions. So I won't go through that. The thematic areas that the panel of experts will discuss will include governance and reform initiatives, resilient and health workforce, human resource management, digital transformation and e-governance, ethics and accountability. This will also provide guidance for the thematic discussions today. So, distinguished ladies and gentlemen, merci, thank you, gracias.
That was the Civil Service Agency Director, Honorable
to our dynamic Director General
Josiah M. Jokai Jr.
for our fulfilling overview of why we are here today. Just in case you didn't get that, we are here for just 4 reasons. The first reason is to interact with our challenges so we can know what's going on in the sub-region. The second reason is for collaboration. We have a pattern of cooperation. The third reason is to strengthen our public sector. And finally, innovation, solution, and best practices within our health sector and also our public service. Thank you so much, our Director General. Next, we're going to call on one of our colleagues, in person of Grace Morning, Kuti, who's going to give us an overview of the guest keynote speaker. Thank you so much.
Thank you. Good morning to all. Dr. Luis Miguel Coso is a distinguished medical doctor, fertility specialist, and public health professional who has made significant contributions to the healthcare in Liberia. Her educational background is comprehensive, beginning with a BSc in chemistry and biology from the University of Liberia in 1996. She continued her studies at the AMWRT College of Medicine, where she earned her Doctor of Medicine degree. Dr. Coso further enhanced her expertise obtaining a Master of Public Health from the Leone University and a PhD in Tropical Medicine from the University of Liverpool. Dr. Coso's specialization in obstetrics and gynecology, where she enhanced our master's degree of medicine from the University of Nairobi. She also pursued advanced training in fertility treatment in India and obtained a postgraduate diploma in sexual and reproductive medicine from the University of South Wales. Her skills extend to critical areas such as assisted reproductive technology, laparoscopy, and abdominal ultrasound, particularly in low-resource settings. In addition to her clinical expertise, Dr. Coso has demonstrated exceptional leadership. She has served as the president of the Liberia Medical and Dental Association, the president of the University of Liberia Student Union, and the director of the epidemiology unit at the Ministry of Health, which later became a part of the National Public Health Institute of Liberia, formerly known as NPHIL. She is also an active member of several international organizations, including the American Public Health Association and the World Laparoscopy Association. Dr. Coso is committed to bridging in the healthcare service delivery and outcomes in her role as the Minister of Health of Liberia. Her work is deeply influenced by her Christian faith and her dedication to philanthropy. She is married to Professor Dr. Robert Kozo, and they have been blessed with many children. Ladies and gentlemen, Dr. Louise Mabel Kozo, Minister of Health, Liberia.
Good afternoon or morning? So good morning. And once when the young lady who brilliantly read the remarks for me, introducing me, and once everything, the good portion that I like is the president of the University of Liberia Student Union. All other accolades can go away, but that one remains with me for life. I'd like to recognize Mr. Madrid. I've been with them since I was young, from the University of Liberia, and I've seen them, they have grown. So my salute to you all. Dr. Josiah E. Jordan, Director General, Civil Service Agency. And before I even start, I don't like to speak after Jordan because he says everything. So apparently he has preempted my speech, so I just want to re-echo what Jordan said. So please, Darlington, anytime, don't go Jordan in front of me. To our distinguished delegates, representatives here, Civil Service Agency, HEPAC, partners organization, esteemed guests, ladies and gentlemen. It's an honor for me to welcome you all here today and to our guests, to our beloved country, Liberia, the home of hospitality, and specifically for this landmark regional service leadership conference on health workforce development. Although the president will come, but I also bring you greetings on behalf of the president, His Excellency Joseph Mafeka. This conference today is a recognition of our common challenges and common opportunities. And that is the need to build, sustain, and optimize a resilient workforce capable of delivering quality of care to every citizen across our region. Liberia is honored to host this critical dialogue as part of our commitment to advancing public service excellence, health system strengthening, and workforce development that aligns with the agenda, the African Union Agenda 2063 and the SDGs, specifically the SDG 8 and 3, the 3 which is good health and well-being, and 8 decent work and economic growth. This conference is a milestone event, not just in addressing workforce, but also in strengthening public sector governance and institutional reliance. The network of civil service agencies for health workforce in Liberia that is going to be launched through this gallery represents a transformative step towards institutionalizing best practices, ensuring merit-based recruitment, fostering regional collaboration to address systemic challenges such as ghost workers, absenteeism, and suboptimal workforce performance. Our gallery here honors schools of stark reality that will help a strong, well-trained, and reputable distributed workforce. Our aspiration for universal health coverage and and public health security remains a challenge. Across our regions, countries grapple with critical shortage of skilled health professionals, inequitable workforce distribution, and challenges in workforce retention and motivation. As if that is not enough, the tsunami exodus of trained professionals to regions of greener pasture further exacerbate our challenges. At the height of Liberia's health system transformation, we have witnessed firsthand the indispensable role of our community health workers in bridging the healthcare gaps, particularly in remote and undeserved areas. Please give a round of applause to our community health workers. The Community Health Assistance Program that was launched in 2016 stands as a proof to the power of strategic investment in professionalizing community health workers and ensuring that they receive adequate training, supervision, and remuneration. Our experience in professionalizing community health workers has yielded invaluable lessons. First, the political commitment and public policy leadership. Nigerian government has championed policies and integrated the community health workers into the national health system. This commitment ensures the adoption of structural training, certification, remuneration mechanism, and setting for precedent for sustainability. Partnership for sustainable workforce financing. Through strategic engagement and multilateral and bilateral partners, which include the Global Fund, USAID, Last Mile World Bank, and the list goes on. We secure long-term funding addressing concerns around sustainability and workforce stability. We have strengthened governance and regulation. Also, we have harmonized technology for training and workforce management. This conference represents an unparalleled opportunity to leverage collective expertise and regional collaboration to address shared priorities. Through this structured dialogue, as I was just telling our DG, I said the next time, please let everybody face it, but if you don't know, so they can be looking at me. So, DG, that woman, you have to tell the chair right now. I don't be looking on that side. Yeah, especially the females. Females. So, at the end of this, we hope that, and we know that happening, that through this dialogue and partnership will develop a regional public service leadership framework for workforce development. We will strengthen our workforce governance with a focus on recruitment, retention, and career development pathways. We advocate for sustainable domestic financing mechanisms that reduce over-reliance on dollar funding. We enhance cross-border workforce mobility framework in every equitable distribution of skills health workforce within our region. So that means if in Guinea they need a health workforce or somebody from here to go and work alone, our counterpart will do that. If they need us on this side to go to Burkina Faso, that cross-border workforce, that's what we're looking for to use. So before I take my seat, I'd just like to say that let this conference be a defining moment in a commitment. But also, we should have actions. Our discussion must be bold, our recommendation transformative, and our implementation unwavering. So our colleagues who came, Liberia, we are ready to stand, collaborate, and share and lead this journey towards a resilient and responsive health workforce. So now, I don't know that Dr. Jota, do I have proud to open this conference. Now with the panel vested in me by the President of the Republic of Liberia, with the arrest agenda given to me, I now declare this conference open.
Thank you so much, Dr. Poto. We are doing something in Liberia. We are making things happen. We are getting into partnership. We are doing political commitments. We are also clearing, we all know host names, and the list goes on and on and on and on. Thank you so much. Thank you so much. As a reminder, while we are here to foster collaborations, we are here to strengthen governance, and also endure efficient public service delivery. That's the entire objective of us being here for the next 40. So I want to say again, welcome and thank you, Madam Minister of Ministry of Health. Thank you so much. Now we're going to call on the head of the HEDPAC. For those of us who don't know HEDPAC, it is the Health Development Partnership for Africa and Caribbean. It is a global health initiative that leverages the valuable lessons learned from COVID. Ladies and gentlemen, our health delegates from HEDPAC, you're welcome.
Thank you very much. My name is Thomas from HEDPAC. I'm the Community Program Advisor for HEDPAC and representing the organization. So, good morning, everyone. Honorable Dr. Lucia Joaquin, honorable delegates of the countries, and distinguished guests, HEDPAC warmly welcomes this inaugural conference of civil service agencies and institutes of health for health workforce development in Africa. And I would like to congratulate the Liberian Civil Service Agency for organizing this conference. The conference marks a crucial step towards addressing the systemic and structural challenges of the health workforce in Africa, and also improves efficiency for the health system and overall health workforce. And we hope the efficiency that's gained from this reform will pave the way for the integration of certified professional community health workers into the civil service system and among others. Through collaboration and knowledge sharing, the network aspires to strengthen health workforce capacity and accelerate progress towards universal health coverage. And at HEDPAC, we are fully committed to support the establishment, but also the maintenance of the network to address the health workforce challenges and the progress towards universal health coverage. Once again, I would like to thank the Civil Service Agency for organizing this conference, and also for delegates coming from other countries to share experiences and exchange learnings. And we hope this network will continue to further accelerate the exchange of ideas and best practice among countries, and we also hope other countries will do it also. Thank you very much.
Thanks for that brief remark from the delegates from HEDPAC. Next, we will call on the representative from La Côte d'Ivoire, who's going to give us a brief remark.
suis obligé de m'exprimer en français. J'espère que vous pourrez comprendre le français de mon propos. Je suis Samarassi, madame le ministre, monsieur le secrétaire général de la République, monsieur le président du partenaire, mesdames et messieurs les experts, chers collègues, mesdames et messieurs, tous en haut rang grade. Je suis Samarassi Abdoulaye, directeur de la gestion administrative des personnels civils de l'État en Côte d'Ivoire. Je suis expert du président de la Côte d'Ivoire. Je voudrais que je sois permis, au nom de Mme Anne Désirou, ministre d'État, ministre de la Fonction publique et de la modernisation de l'administration de Côte d'Ivoire, je vous remercie pour l'honneur et la gratitude que vous fait à notre pays en la personne de la invitation à participer à cette importante conférence. Madame le ministre d'État, qui certes ne prend pas personnellement prévu le placement, a néanmoins dépêché l'un de ses proches collaborateurs, la personne du souverain locaux et son conseiller technique qui considère la demain conformément au programme stratégique. Pour ma part, je me réjouis de cette initiative entreprise par les autorités du Bénin en collaboration avec le partenaire pour le développement de la santé en Afrique dans le Caraïbes, EPAC, dans le représentant qui va devoir une satisfaction essentielle. Une initiative qui a pour objectif d'améliorer la santé par le renforcement des capacités du personnel de la santé. Pour les pays africains, en termes de développement comme les nôtres, la santé des populations est un facteur important car elle constitue à la fois une condition et une résistance. En effet, il n'y a pas de développement sans population en bonne santé pour produire des biens et services nécessaires à la croissance du pays. De l'autre côté, la santé des populations est un indicateur primordial du niveau de développement des pays. C'est pourquoi, en Côte d'Ivoire, dès son accession à la magistrature suprême, le président Alassane Ouattara a initié un grand programme hospitalier avec notamment la gratuité des soins pour certaines personnes touchées, vulnérables comme les femmes et les enfants, l'adoption d'une nouvelle loi portant le fonds hospitalier, prenant en considération l'attente de population et les intérêts des secteurs de santé, la construction et la réhabilitation de nombreux CHU et des centres de santé, l'ouverture du centre de santé spécialisé en cardiologie et cancérologie, le renforcement du parcours technique en toutes les structures sanitaires et surtout l'accroissement du personnel de santé et son équipement sur toutes les zones du territoire afin d'améliorer les relations professionnelles de santé et de population définies par l'OMS. Il y a enfin la mise en place de la couverture maladie universelle pour assurer la prise en charge du travail des populations. Mesdames et messieurs, les récentes crises sanitaires mondiales nous ont convaincu que la santé des populations ne doit plus être exclusivement envisagée dans le cadre national, à l'échelle des pays. Il nous faut agir ensemble. La population dans les États africains apparaît comme une nécessité vitale. Nous devons renforcer cette capacité de résilience extraordinaire dont nous avons su faire preuve dans la réponse contre la COVID-19, le virus Ebola et les postes. C'est pourquoi Mme Anne Désirou, ministre d'État de la Fonction publique de Côte d'Ivoire, soutient cette initiative et souhaite que les travaux des experts aboutissent à proposer aux délégués des pays un cadre de coopération novateur entre nos États pour la santé, la bonne santé de nos populations. Je vous remercie pour votre aimable attention. Très bien.
We will now have a representative from Serbia to give us remarks.
Thank you very much. The Director General of the Civil Service Agency in Sierra Leone is a very powerful man. He's a very powerful man in Sierra Leone. In fact, for us, he's the Secretary to Cabinet in Sierra Leone. So he's a very powerful man. Distinguished representative of EPAC, Lorenzo is present, other distinguished dignitaries there, dedicated staff of Liberia Civil Service Agency, if you are here, can you shout amen? Amen. God bless you. The media, ladies and gentlemen, but really I don't want to forget our colleagues, the cultural group. I really want to give them a shout. Dr. Joker, probably what you did not know from the music they were singing, I feel like I'm Liberian. So thank you very much. I bring you greetings from the President of Sierra Leone and the people of Sierra Leone. It is an honor and privilege to join colleagues, experts at this pivotal regional public service leadership conference comprises of 6 countries. This is very important, as it was mentioned by Dr. Jokai, we have similar challenges and more reasons why we are here. Human health workforce is a critical component of our national development agenda, and this meeting is timely. In Sierra Leone, the health technical workers, we call them health technical workers, they account for over 16,468 workforce. And in fact, they are the highest in the civil service, which that's why we pay a lot of attention to them. Ladies and gentlemen, I'm happy to be here. I'm happy to inform you that Sierra Leone delegates will participate fully in this program. We share our experiences, our reforms that is going on in the health sector, as well as the care processes that is taking place in the Sierra Leone health sector. For these 4 days, I think it's very important. Dr. Jokai is timely, so that's why we are here. The complexities of our health system, the urgent need for effective framework, and the essential demand for transparency and accountability are issues that resonate profoundly across our borders. And this, the Honorable Minister mentioned that very clearly. On behalf of the people of Sierra Leone, I would like to express my heartfelt gratitude to the Civil Service Agency of Sierra Leone, and most especially the Director General. We are building a partnership that will strengthen health sector across the countries named before. So on that note, ladies and gentlemen, I thank you very much.
Thank you very much. We will now take remark from representative from Burkina Faso.
Good morning, Liberia. Good morning. Okay. As I am the Francophone, I am going to speak in French. Donc, mon cas c'est Dialama, c'est mon nom, directeur général de la fonction publique du Burkina Faso. Je dirais que nous avons été vraiment très contents d'avoir été associés à cette conférence qui est très importante pour les secteurs de la santé en Afrique de façon globale et dans notre sous-région. Je dirais que cette préoccupation est une préoccupation de haut niveau
également chez nous au pays, car comme ils l'ont dit, mes prédécesseurs l'ont dit, nous faisons face au même défi. Le défi d'avoir des ressources humaines compétentes pour que notre secteur de la santé à un niveau vraiment acceptable pour le profit de nos citoyens. Le défi de retenir un certain nombre de profils qui sont prisés également dans d'autres pays, parce que vous savez que dans certains pays, la population commence à être vieillissante, donc pour avoir certains profils jeunes, pour tenir certains secteurs, c'est devenu compliqué. Donc dans l'Afrique, on vient pratiquement fuser nos compétences. Donc il y a ce défi-là à relever. Il y a le défi aussi de la formation, effectivement, des acteurs de la santé et le défi de leur répartition sur l'ensemble du territoire. Donc, ce sont des défis communs que nous avons également avec d'autres pays, parce que hier, quand j'arrivais de discuter avec mon frère de la Côte d'Ivoire, c'est comme si, franchement, on officiait dans les mêmes pays. Donc, cette conférence est une opportunité pour nous d'échanger nos expériences et de partager sur toutes ces expériences-là pour pouvoir aboutir à quelque chose de commun. En tout cas, au Burkina Faso, nous sommes vraiment engagés. C'est un pays qui est engagé depuis la fin des années 90 en matière dans les domaines des réformes, en matière de fonction publique, dans le secteur de la santé est une priorité. Parce qu'il faut le connaître chez nous, et le ministère de la Santé constitue le deuxième effectif de la fonction publique burkinabé. Donc c'est un grand effectif qu'on a à gérer avec beaucoup d'emplois différents. Donc nous travaillons fortement à mener des réformes qui pourront être profitables aux citoyens. Donc c'est ce que j'avais à dire. Merci beaucoup. Thank you very much. I'm very grateful to Liberia for associating our country to this conference, which is very important for Africa and for our region. We face the same challenges in Africa, as said the Honorable the General Director of your agency. We face the same challenges in Africa, and this conference is an opportunity for us to discuss, to share our experiences, and to achieve a common policy, if possible, to how can we say, to find a solution, a global solution for all the countries who are invited here. This is the opportunity for us to see how we can contribute to a global solution for Africa. I'm very happy to be here. Thank you very much, and good conference for us.
Lastly, for a remark, we will call on the President of the Civil Servant Association. And right after him, we're going to take our health break. You can go out and, just in case you want to use the restroom, stretch out, and we're announcing we'll be back or have your lunch. Thank you.
And fellow visiting guests, I bring to you greetings from the civil servants of the Republic of Nigeria, particularly health workers. We like to welcome you officially as workers' leadership into the shores of Nigeria. This conference, Director Joka, could not have come at any time better than now. If we just see around us the outbreak of diseases, the outbreak of viruses around. First we encounter Ebola, then we went to COVID. It tells you that this level of togetherness is compelling and is necessary, not only for health workers alone on the front line, but for the general workforce of all the countries that are here represented. It will now also come at any better time for us as citizens of the various countries that are also represented here. So we welcome you and we welcome this initiative. We believe together, like you heard from the Madrid group, if we hold together as Africans, we become much more innovative to always think ahead as to the next epidemic that will be coming, or the next virus that will be coming. If we prepare ourselves as Africans, we think it is a necessary step and a protective gear for all Africans. So we want to welcome you, and we thank you for this initiative, and we'll be here to carry this process through. Thank you very much.
Focus on
So starting with the
Liberia,
police,
the president.
who are part of the Inter-Ministerial Steering Committee, we will take remarks from you as well. Please, any representative.
In case you're just joining us, it's Focus on Liberia live broadcast. We are at the Ellen Johnson Sirleaf Ministerial Complex, where a leadership conference on health workforce development is being held by regional service. Right now, we're wrapping up for the first round of the conference today. So you're welcome.
Thank you very much. Good afternoon to all. Honorable Director General, our visiting guests from our West African countries, various entities here, various organizations, our partners in progress, foreign on behalf of the Liberian National Police, the Inspector General of Police, Honorable Gregory O.W. Coleman, have conveyed his message to you people because of the engagement that we have in our country. He's unable to be here, but he's in here with you guys in spirit. Deputy Commissioner of Police, George Jones, or Deputy Commissioner of Administration, co-signed in one way. Having this program today, we are happy and we're glad to be part of this program. It's very unique and very important that we have these programs as it relates to the health issues of our various workers, the health issue of our men and women in blue on the field, which we face with at the Liberian National Police. There are a lot of issues, there are a lot of challenges, and we show and hope with this workshop, with this program, we will collaborate, work with you people, and make sure that wherever that we can get it simulated and be applied at our entity. Thank you, and welcome to the
Thank you very much to the Liberia National Police. So we have a representative from Immigration. While we are waiting someone from Immigration, we will ask for a representative from Foreign Affairs. Okay, what's about Liberia Airport Authority? And also, if we have a representative from the Ministry of Health, you can come right after him, and also the General Service Agency.
Good afternoon, ladies and gentlemen. On behalf of the Minister of Foreign Affairs, Her Excellency my Southwest Leone, we'd like to welcome and appreciate everyone for participating in this all-important conference. We express our heartfelt appreciation to the different delegates from Ivory Coast, Burkina Faso, and all of the different countries. We've heard the different challenges faced in our different regions, and then we look forward to the resolution that we believe will foster change and promote health development in our different health sectors. Thank you.
Focus on Liberia live broadcast. We have remarks from government entities on this Public Service Leadership Conference on Health Workforce Development. Previously, that was a representative from the Ministry of Foreign Affairs.
Good afternoon. I'm Edwin Sato from the Liberia Authority. I want to use the medium to extend the Airport Authority greetings, specifically from the Managing Director, His Honor Honorable Gerald Mesco, and the management team. And we also want to use this medium to extend our thanks and appreciation to the CSA for allowing us to participate in the all-important program. When it comes to enhancing our workforce ability and to deliver a merit-based system of recruitment in our republic. As a matter of fact, at the Airport Authority, we also want to use the video to let you know that we cherish career development so much that currently we have a program running because for our sector we believe in career development and continuous learning. So we pledge our support to the CSA to ensure that the program is a success. Thank you.
Thank you very much. Like I said earlier on, we hear a representative from Ministry of Health. If there's anyone here.
Hello everyone, my name is George P. Jacobs. I'm Assistant Minister for Policy and Planning at the Ministry of Health. Please allow me to stand on the system protocols. You know, the Minister of Health has spoken, so we thought we had to make a statement, but having been invited, I say something. So let me join all of the previous speakers to welcome our distinguished visitors to Liberia and all of the participating delegates to this all-important conference. As the Civil Service Association has said, this conference will not come at a very important time than now. For us at the Ministry of Health, one of the critical challenges we have is the health workforce. Liberia, we have very limited health workers in our country to provide quality services. We have less than 50% of the health workers we need to achieve universal health coverage. And so you can imagine how challenging it is with more health care in our country. But again, as a country, we are planning to revise our 10-year health workforce policy. In the next 2 weeks, we will be commencing the conduct of the National Health Worker Census, delivering all health workers across the country, and that will provide us the useful data to inform the view of best health worker policy. So this conference will provide us useful information with experiences across our region to inform the development across our policies. So we are very happy to be here. We've come to learn. I'm here with my colleagues from the Ministry of Health, or the Director of Human Resources, Jim Jens, is here. Get little hands of Jens so we can see you. The Director of Policy and Planning, Nancy Dama is also here with me. The Director of Community Health Workforce, Mr. Lafo, is also here. We are here participating fully in this process of developing a comprehensive framework for health workforce development. Because we know we have a lot to gain from here, whether as a host country, and with all the experiences we have gathered from across this continent to show we reach our positive development. Thank you, and wish you all the best. Happy New Year. Thank you.
Thank you very much. We will now take remark from the Executive Director, Honorable Sandy of the National Commission on Disability.
Greetings, everyone. My name is Samuel Dean, and I'm the Executive Director of the National Commission on Disabilities. And I also pride myself in a self-title that I call Chief Inclusivity Officer of the Republic of Liberia.
Focus on Liberia live broadcast. We're sorry for darkness. We have lost power. Power is off, and so technicians have gone out to put things together. But we still just tune in. Focus on Liberia TV. So I urge that you stay. My name is Gwendolyn Dorado. As a public service leadership conference on health workforce development, participating countries, Liberia, Sierra Leone, Ivory Coast, Burkina Faso. So this conference is being held to sorry for darkness. Technicians have gone out to work on things. And then we're having a remarks from the National Disabilities President. Get closer.
So I would like to thank the CSA and the Ministry of Health for such a conference, develop a framework on health workforce development. And I would also like to appreciate our partners and our African brothers and sisters who has never failed to collaborate with us in peace and wartime. Having said that, I would like to make a few contributions to the conference.
And so you're welcome back. Our power is back, and so the program continues.
Since we are here to recognize gaps and find solutions, I would just like to delve into advocacy from the onset. I would like to appreciate the Civil Service Agency for choosing this place to conduct such a monumental program. Because this is the most accessible place in the Republic of Liberia. Frankly, the Ministry of Health didn't do justice in that direction. There's an elevator installed there. It's a mooring facility. Unfortunately, the elevator doesn't work. And I believe that if we are to have these conversations, we need to internalize the change we wish to see. So I would like to kindly admonish respectfully the Minister of Health that they kindly work on the repairs of the generator, for the fully function of the elevator. Because if we have to internalize the inclusivity in the arrest agenda, we have to do it without an iota of hypocritical rhetoric. I would also like to identify the fact that in the healthcare sector, physical therapy or physiotherapy is not something that is of top priority. Well, we all in Africa know that disability issues are not issues of top priority. They're low on the priority. That's why these conversations are important. And when I say in Africa, I mean that quite literally. I had the opportunity to go to a conference, an ECOWAS conference in Nigeria on inclusivity. The irony is, when I tried to use the bathroom, I couldn't fit in the bathroom. So everybody had to see me do my business. Now, I would like to congratulate the president, the past president, Her Excellency Ellen Johnson Sirleaf, for being so innovative and foresighted in creating this place, and also the airport, because there are handicapped restrooms that you go to, to use comfortably and ease yourself. So I think that's a success story for Liberia. And the Director General could have chosen a better host country for such a conversation. Women and disability. We know that women with disability have double disability in the context of intersectionality. We have to do more to employ women with disabilities in the health sector. I know that I heard of a woman with disability, and I'm going to be anonymous, who worked at the Duper Road Health Center. But unfortunately, as an administrator. But unfortunately, when our government took over, she got sidelined or ostracized. And she reached out to me, and I tried to reach out to the Minister of Health, but it's like literally in her deep to get her on her phone, so I couldn't get in contact with her. But I think that there's no secret in trying to improve things and making sure that we internalize this change that we wish to see. So I would just like to thank you all for the opportunity, and I breathe in prayers that whatever framework that is set up today, that we live by it and live with it. In Jesus' name, amen.
Thank you very much. We will now take remarks from the Managing Executive Director of FDA.
Remarks from different government entity on the conference. previously, that was the president of the National Disabilities, and right now we have a representative from FDA.
Good afternoon, fellow citizens of Africa. We are grateful to be here. I'm Actor from the Forest Development Authority. My name is Victor Kunisa, the Deputy Managing Director for Administration. For and on behalf of my Managing Director and the management team, I want to say a very big thank you to our CSA and our countries that have come to be part of this sector for us to talk together on health issues today. I've come from nature. We from the forestry sector, we experience nature every day. We see good things that you don't see because we are in the forest to see things that you don't see every day. But before coming to the forest sector, I served as hospital administrator for 5 years. It will surprise you to know that the challenges are very hard. If you check in the hospitals today, majority of the workers that are there are volunteers. You have sometimes 60-40, sometimes it's 70-30, but the number of people who are outside, they just say, I want to work, just allow me to be volunteers in the hospital today, you cannot count them. So to come with such a program is actually timely. We can work together to get the health sector better. One thing I noticed, once the health staff is better, we are assured of being better to work. So we encourage all of our members today from the various countries that we can put hands together to make African health sector strong. By that, we can live and live better. Other than that, all persons that are within the very entities, we are at risk. So we want to say thank you. Let's be strong together. Let's make sure that our health sector can be strong with good manpower. And after the manpower development, the next thing we experience, maybe when you move to the other step, then we tell you where next to go. Thank you very much.
Thank you very much.
That was a representative from the Forestry Development Authority.
Alright, so thank you so much, Tina and Stevia. Before we do the picture, take now let's say there's going to be a group picture. We're going to round up before here with the bottom behind us in the background to take the picture. It's going to be the official picture. But the actual official picture is going to be on Thursday when His Excellency the President will be here. We're praying that he visits our location and address it officially.
So folks in Radio Land,
we will be around, we will network, go upstairs for like 15 minutes. If you have coffee, you can take coffee, tea or anything upstairs.
Focus on Liberia broadcasts on the public service leadership
section. So for now, we want to thank all of you for this opening session for today. We will now encourage our delegations to come down, all the officials of government who are here. I see the police.
So thanks for watching. This is Focus on Liberia, and 4 days of Regional Public Service Leadership Conference on Health Workforce Development, held under the auspices of the Civil Service Agency right here at the Ellen Johnson Sirleaf Ministerial Complex. And today is the opening of the conference, and we are here from the 4th to the 7th. Focus on Liberia will be here to bring you all live broadcasts. So we said thanks for watching. My name is Gwendolyn Dorado. Tomorrow we'll bring you more. It's bye-bye from my end.